Nearly 70% of women develop fibroids by age 50, with 1 in 4 suffering from symptoms that significantly impact their quality of life. Fortunately, now in North Texas, there's a new procedure called the Acessa procedure. Here to tell us more is Dr. Kimberly Lefholz and patient Don Adams. Ladies, thanks so much for joining us.
Thanks for having us.
So for those who don't know, what are uterine fibroids and what are the common symptoms?
Uterine fibroids are overgrowths of smooth muscle in the uterus. The uterus is a smooth muscle, and these are benign, non-cancerous growths that occur just spontaneously. Women that have fibroids typically have heavy menstrual bleeding to the point that they may not be able to go to work or attend family functions. They have pelvic pain, they have pain with intercourse, they have pelvic pressure, bloating, and they will even have increasing abdominal girth as their uterine fibroids grow. They're very symptomatic.
Okay, so now there's something called the Acessa procedure. Tell us about it.
The Acessa procedure is very exciting for us. It's a minimally invasive treatment for uterine fibroids. It's an old technology with a new use. Using radio waves, we insert the Acessa device into the fibroid, and it actually heats the molecules so that they shake vigorously and heats the fibroid up to 95 degrees Celsius. We then ablate that fibroid for a certain length of time, killing the blood supply and killing the fibroid. And then that fibroid gradually shrinks over time. This is an old technology that's been used to treat liver tumors in the past. It's been around for many, many, many years. But the technology started 10 years ago, and now it's come to fruition. It's a great procedure for women.
It really does sound fascinating. So how long after this procedure will someone start to see results, and what does that recovery look like?
Well, the procedure is an outpatient procedure, which makes it even better. You get to go home the same day. You can go back to work in anywhere from 3 to 5 days. So it's minimally invasive, as opposed to the old-style myomectomy where you had to stay in the hospital overnight and spend 6 weeks recovering. So the recovery is very quick. The symptoms, we usually tell our patients that they may experience some increase in their menstrual bleeding the first 2 cycles, but after that, their symptoms dramatically fall off. Those fibroids start shrinking immediately after surgery, and they will shrink for up to a year, but you start to see your maximum benefit 3 to 6 months later.
Well, Dawn, you know all of this firsthand. You are a patient. What was life like for you before you had the Acessa procedure?
Well, I had really long cycles and lots of pressure in my abdomen, pain. Couldn't wear a lot of my clothes. And so it was very difficult and just constant discomfort. And
what a difference it's made for you since then. Tell us a little bit about what things have been like for you now.
It has. So I can get into a lot of my favorite clothes now. And the pressure is gone, so I don't have the pressure on my bladder anymore. And I can actually see the difference. So the shrinkage is noticeable.
That's great. So, doctor, should we be experiencing all of these symptoms where we know we'd be a good candidate, or just one or a couple?
One or a couple symptoms. Not everybody experiences all of those symptoms. Some women have nothing more than heavy menstrual bleeding. Some women have the constant urgency to urinate because the fibroids are pushing on their bladder. Anybody that has one or all symptoms is certainly a good candidate for Acessa.
Well, we want to thank the two of you for coming in. Thank you so much. So glad to hear you're feeling so much better.
Thank you.
All right, here's the information you need to know about the Acessa procedure. You can log on to acessaprocedure.com for more information, or simply call the number on your screen. It's 972-765-2423.